Hi guys, welcome to another video on living in Canada. Today I want to talk about health insurance here in Ontario, specifically OHIP, which is the Ontario Health Insurance Plan. And this video will be especially interesting to those of you who are planning to move to Canada soon, for immigrants, students, workers. And yeah, I hope this video will be useful to just give you a broad idea about what OHIP is and what it can do for you. I will be specifically covering these 5 things, which is number 1, is OHIP free or not? Number 2, what is OHIP good for, or what does it cover? Number 3, who is covered under the plan and who is not? Number 4, how you can register or apply for it? And number 5, how to use the card. But before we start, I want to share some good news, which is I just got my new OHIP card. So if you look at it, I covered the details here, but basically it has my name on it. It has like a code, my OHIP number, my date of birth, information on when it was issued, and how long it's valid for. So, okay, let's start. One thing that many people, especially my relatives, friends back there in Indonesia where I came from, ask me is health insurance in Canada actually free? And the simple answer is yes, it's free, meaning that you do not have to pay for it. You do not have to pay a single penny in order to be covered by OHIP. But the longer, more detailed answer would be it's not entirely free because OHIP, the Ontario Health Insurance Plan, is actually funded by taxpayers. So people who work here, pay taxes into the system, they are indirectly paying for health insurance. I don't think that it's 100% from the taxes. There is some subsidy from the government as well, but it's not entirely free. This just shows that there's no free lunch. There's nothing completely free in the world. In one way or the other, you still pay for it. There are rarely things that are absolutely free except like for the air that we breathe or so. But anyways, in practice, you do not need to pay anything to be covered by OHIP. So let's go on, and pardon me, I will be looking at my notes once in a while to make sure that I don't forget anything. So let's talk about what OHIP is good for, or what it covers. It covers most medical services here in Ontario, like doctor visits, hospitalization, ambulance services, and so on. Pretty basic things. But then there are also some things that OHIP does not cover, and this is very important. So OHIP does not cover most dental services, except for some dental treatments, such as I think emergency dental services or so. But just to make sure, you would need to go to the OHIP site and check for yourself. But normal dental treatments, such as like fillings and getting an implant, reconstructive dental services, those are not covered by OHIP, and neither are prescription drugs. So that is something very important to know, because there will be a point in time, believe me, where you will need to go to the dentist. And if you do not have any insurance, then it can cost you pretty much. So I would recommend to you guys, if you're planning to come to Canada, do not just rely on OHIP, but get some kind of additional health insurance. And as a student, if you come here as a student, anyway, you will not be eligible for OHIP yet, but I'll get into that a bit later. But if you come here as a worker, then most likely you will get some kind of health insurance from your office. When I was studying, I had access to a health insurance called GuardMe, which I never had to use, luckily. But my husband, who was working at that time, he was covered under an insurance called Empire Insurance at one point in time, and then by Blue Cross. So when I had to go to the dentist, or I had to get prescription drugs, then that insurance would cover part of my expenses, around 50% or so. So it differs from insurance to insurance, and you will need to check the exact details by yourself. So OHIP does not cover these things, unfortunately. But for basic things, just for doctor visit, you're covered. So who is covered by OHIP? If you're a citizen, then you do not need to watch this video, because if you are living in Ontario, then you are covered by OHIP. But because this video is actually targeted for those of you guys who are immigrants immigrating to Canada. You need to know that the people who are covered by OHIP are permanent residents here in Ontario, and also workers who are residing here in Ontario. But there are certain requirements for workers as well, which I will cover in a bit. And there are a few other categories that are also covered by OHIP, and you can just go on the website and check it out for yourself and make sure that you fall into the category who is covered. Yeah, and how about dependents? If you are planning to come to Canada with your spouse or with your kids, then if you are covered by OHIP, then so will your dependents be. So your spouse or your kids will also be covered under OHIP. And very important to know who is not covered by OHIP. Students are definitely not covered by OHIP, unfortunately. And that is why it's so important that you have your own health insurance, either from the country you're coming from or from your college or university. Usually your college or university will give you the option to sign up for an insurance, or many even require you to sign up for an insurance through them. So in my case, for example, that was the insurance Guard Me. I think I paid around $50 or so per month for this insurance, so around $600 per year. So use that insurance, and after you've graduated, once you've started working, once you fulfill the requirements for OHIP, then you can apply for that instead. Or get insurance from your office, which I think will likely provide better coverage. So let's go on. How to apply. So you will need to apply in person at one of the Service Ontario offices, and my experience was actually pretty good. So in order to apply, you do not need an appointment, but you need to make sure that you bring the right kinds of documents, because if you don't have the right documents, then they will send you home, and then you will need to come back another day, which is really a hassle. So there are some very basic documents that you always have to have with you. Usually when you're applying for certain government services, these are like some basic documents that you will need. This includes your ID, for example, your passport, and then proof of residency, proof that you are living in Ontario. That could be a driver's license, or usually they would accept a bill, like a credit card bill as well. It needs to have your full name, your formal name, and also your address. And then you also need proof of your immigration status, which is basically your work permit, your open work permit, or your PGWP. And pay attention to the validity date, because the validity date that they will give you for your OHIP card, for your coverage, can only be as long as the validity of your immigration document. So this is what I mean. If your work permit only goes, let's say, till June 2022, then your OHIP card validity cannot go longer than that. So next year, when you get a work permit extension, then you will need to go back and extend your your OHIP, and that is actually what happened to me. So this was my old card. I went to Service Ontario and I did the application thing, and then after a few weeks, this came into my mail, my new card. And when I was at Service Ontario, they actually punched like, oops, sorry, this one, they actually punched like a hole here into the card, showing that this is no longer valid, that I cannot use this anymore. Okay, and this is very important to know if you're coming here as a worker, if you're applying for OHIP. When I went to Service Ontario, they gave me this leaflet, and this leaflet basically contains the specific kind of documentation that you need to bring if you're applying for OHIP as a worker. But please remember that these requirements can change from time to time, although I think it's a pretty basic requirement. But just to be sure, always go to the website and check out the latest requirements, because this is something that can change. Okay, so the first thing that you need, very important, you need an employment letter. You need an employment letter and not a contract. So these are two different things, and you need to specifically ask your HR department for the employment letter. And this needs to be printed on the employer's company letterhead, meaning it cannot be an email or just like a note. It has to be an official letter. And there's some things that need to be stated in the letter itself, which is number one, that you are working full-time. So you cannot get OHIP if you're just working part-time. It also needs to have the title or occupation, your position at the company, and it also needs to state that you as the employee will be working for an employer that is located in Ontario. So you cannot apply for OHIP but you're working in Vancouver, for example. It has to have the start date of your employment, and most importantly, it has to state that your employer intends to employ you either permanently or at least for 6 months. So it cannot just be like a 3 months contract thing. That will not work. And most importantly, sometimes people forget this, the letter needs to be signed and also dated by the employer. Okay, there's a reminder down here, very important. Don't forget, it cannot be an offer letter or an employment acceptance letter. So it has to be an employment letter. Just make that very clear to your HR. Yeah. So, yeah, how to apply, let's go back to that. So at Service Ontario, you bring all your documents, the specific employment letter, and then you will be there for around 15 to 30 minutes. They're actually quite efficient, and then they'll take a picture of you and then send you home. But before they do that, they will give you like a temporary OHIP letter. It's a letter, sorry, I don't have it with me right now. It's just a letter that confirms that you are officially covered by OHIP effective that day. Or I think sometimes they even give you a starting date starting from when your immigration document was valid, so backdated. But in any case, latest on that day when you apply for OHIP at Service Ontario, that will be the start of when your OHIP is valid. Yeah, and then after a few weeks, I think was around 2 weeks or so for me, yeah, they'll send you your OHIP card and you're ready to use it. So the last thing that I wanted to talk about is how to use it, and that's the simplest part. You simply take your OHIP to your doctor where you want to get your medical services, and before you start your treatment, your checkup or whatever, you give your card to the receptionist and they will get your details. They will confirm that you are covered by OHIP, and then you will not need to pay anything. Except, don't forget prescription drugs. You still need to pay for that. So I would caution you to always, before you go to a doctor, before you start your checkup or your treatment, always ask and make sure that it is covered by OHIP. It likely is, but you don't want to get any surprises. You don't want to get any huge bill. So it's just better to check up front and ask, will I need to pay anything, or is it fully covered by OHIP? And if I need to pay anything, how much do I need to pay, etc. And if you have additional coverage from your office, then you might be able to get part of that covered by your office and part by OHIP, and so on. Yeah, I hope that this video was useful to you. In the future, I might make another video on OHIP that might be a bit more detailed, more comprehensive. So in the meantime, you can perhaps just leave me your questions down in the comments below, so I might be able to cover that in my next video. Thank you so much for watching, and I'll see you again soon.